Okay, let's just start with a simple question. Do you have a secret map to your health?
A secret map. I like that.
Because for so many people, especially if you're managing diabetes, that map, well, it actually exists. It's all in your numbers from blood testing.
It absolutely is. And for this deep dive, we're really focusing on information that's relevant to you, whether you're here in Clydebank or anywhere across the UK.
And we're drawing on the guidance from the Blood Test UK website.
That's the one. A really fantastic resource.
So our mission today is simple. We want to unlock the huge benefits of regular testing. Let's just unpack this. Why is checking your blood sugar numbers the absolute cornerstone of managing your health?
What's fascinating here is that testing gives you control. It's a crucial checkpoint. It puts you in the driver's seat.
In what way?
Well, immediately, it helps you make good choices, about your food, exercise, that sort of thing.
Okay, so that's the day-to-day. But what about the bigger picture? The long-term benefits.
That's where the real power is. Regular checking helps stop the big, long-term health problems from ever starting.
So we're talking about prevention.
Exactly. We're talking about preventing things like serious heart disease, kidney failure, even nerve damage. Getting those checks in early helps so much.
So how often should you be checking? What's the general advice?
Typically, it's about every 3 to 6 months. That's for tracking progress.
But not for everyone.
Right. If you're newly diagnosed or maybe your medicine is changing, your doctor might want to see you monthly. The key is always ask your doctor.
Of course. Here's where it gets really interesting for me. What kinds of checks are we actually talking about here?
Well, there are two main ones the source highlights. First is the fasting plasma glucose test.
Right, the one where you can't eat.
That's it. You can't eat or drink anything except water for 8 hours before the test.
And why is that so important?
Because it gives a true baseline. It removes the effects of a recent meal, so you get a really accurate snapshot of your body's resting state.
So that's the right now number? What about the other one, the A1C? That's the one you hear about a lot.
Yes, the A1C test. Think of this one as the average check. It's brilliant because it shows your average sugar number over the last 2 or 3 months.
2 or 3 months, so it's not just a snapshot.
Exactly. It helps the doctor track how your whole management plan is working over time.
And the Blood Test UK source also mentions newer tech, doesn't it? Things that make it easier.
It does. It talks about continuous glucose monitors or CGMs. These check your numbers all the time, automatically.
That must make a huge difference.
It really does. It smooths out the journey.
And just to bring this home for people listening, the source confirms that, say, if you're in Clydebank, you can get these tests at your local GP.
Yes, at your GP clinic, or you can go to private clinics as well. They're very accessible.
So what does all this really mean? What's the biggest takeaway here?
I think the biggest takeaway is that having that clear view, that knowledge you get from testing, it gives you the power to manage your condition and honestly improve your whole life.
It's the difference between driving blind and using a GPS.
That's a perfect way to put it.
And just to remind everyone, we gathered all these key facts from that essential guide on the Blood Test UK website.
So if consistent monitoring can lower the risk of severe issues like heart disease and kidney failure, what is one simple, healthy step you can take today to build on this knowledge and protect your future?